and I will be presenting my project on catheter-associated bloodstream infections, on the statistical analysis behind them, and what we can do to prevent them. Catheter-induced bloodstream infections are a worldwide problem that is occurring out of every 1 to 4 central lines out of 1,000. So every 1,000 central lines that are placed, there are 1 to 4 Clabsis that are occurring within these central lines. This is a pretty large number due to the amount of usage of central lines, especially in modern times and within the ICU setting. So my Pico question that I have presented is, my population that I'm referring to is adults within the ICU, adults that are within critical care, not step-down units, not the floor. Just this presentation is based off of all individuals that are specifically within adult ICUs. My intervention that I have came up with is multiple different things. Something just as easy as possibly changing caps on the end of a central line, or whether it's changing dressings or limiting the use of those. But the biggest thing about intervention is prevention. So preventing the infection before it occurs. My comparison that I have created is within previous years of how much of an increase Clabsis have been rated. Years like within 2019 to 2020, and then years after, and how much they have decreased due to certain resources, specific things that they did and did not have. And my outcome would be just to decrease the overall risk of Clabsis. Like I said, prevention is the intervention. The biggest things that we can do with this, I know sometimes it is inevitable to get an infection with central lines due to just being a large bore access, but it is important to use prevention as the intervention. So the clinical background. So between the years of 2019 and 2020, there was a 200% increase in Clabsi rates. This was due to the COVID-19 pandemic, whether it was a lack of resources, lack of time, ratios, patient to nurse ratios, just an increase of overall critical, and it was just inevitable for some of these things to be prevented. There was a lack of PPE, time, resources, and it shows that recent studies between Clabsis are now decreased by nearly 88% since 2020. This is a big decrease from those between that 1 year of 2019 to 2020, and then how much they have decreased from 2025 since 2020 of nearly 88%. That's almost, that's an increased rate. So the observation that I have listed, I had listed this in a couple of my previous other papers, is the observation of central line associated bloodstream infections between the years of COVID. So we can see 2018 there was minimal increasements. 2019 there was a large increasement with nearly 12.5 within 1,000 days, or 1,000 central lines that have been inserted. Along with the years of 2020, we can see an increase in 2021. That increase was almost doubling due to the lingering of the pandemic and the situation that was occurring. So I had also listed this. This was my research study that I had gathered together in like my study sample, my size, my population, and all of that. So I had looked within specific hospitals and Clabsi reduction across within the United States. 8 hospitals were studied. The intervention that they used was a multidisciplinary intervention, which was collaborating with different teams to decrease the rate of Clabsis, along with controlling and really deep diving into what could be an independent and dependent variable down to the statistical analysis of how to truly decrease Clabsis. It also shows how we are comparing and contrasting the effectiveness of different interventions that could be working and that could not be working. Another interesting study that I had on here was also during the COVID-19 pandemic. 27 interventions were performed. Most of these were based off of education. And it showed that there was a large decrease just off educating the nurses, educating the physicians, just being a general education to all the resources within the hospital, which could also be an interdisciplinary question that was observed. So some interventions that I think that will help decrease Clabsi's. The most important intervention about reducing Clabsi's is prevention. I know I have said this a couple other times, but whenever we put in prevention into practice, it truly decreases the outcome of Clabsi's. A lot of times, Clabsi's begin to form within days after insertion. A lot of times, it could even occur at the direct site, but we don't see infection until days later. And all it takes is just one little antimicrobial to get into the incorrect spot and have a Clabsi's perform. So some interventions that I thought could work are shown, studied, statistical analysis that have been proven to alleviate the risk of Clabsi's. Is changing the dressings every 7 days. We can see here, this is typically what a central line dressing looks like. It has a CHG patch in it that just helps prevention. It helps antimicrobial. It clears CHG, kills most bacteria like MRSA, just E. coli, just things that we are commonly seeing within the hospital, and what most infections are caused by. CHG helps eliminate those. Another thing is limiting central line insertions. Use a PIC line. Use peripherals. I know sometimes ultimately in the ICU we use pressors, we use medications that have to be ran through a large bore access due to if you're running 10 to 20 mics per minute of Levofed, it can cause infiltration, and if that would infiltrate, it would cause necrosis to the arm or the site. Although this can happen with a central line, it is more likely to happen with like a peripheral or a smaller line. Therefore, it is indicated to use a central line, although if the patient is coming off of the drips, there's not having any acute changes, it would be important to maybe think about switching to a PIC line instead of having that large bore access. Another thing that's very simple, that's easy for nurses to do, is just changing the caps. These are just little blue caps that screw onto the port. They have alcohol and antimicrobial in them. The way to properly use them is to put them on there, allow it to dry for 15 seconds, and then hook it up to whatever medication or whatever you're administering through that central line. Another thing that could help be a large intervention is removing the central lines when they're no longer indicated. So if you have a patient that has been on Levofed, they've been off of it for 24 hours, it doesn't look like they're going to be indicated to have to continue being on that drip. It would be important to remove that central line as soon as possible, just so intervention, prevention can all be used to stay away from Clabsi's. It is also important to utilize the site and the placement of where the central line is placed. Obviously, as nurses, we don't put in central lines. That is typically providers, physicians, but it would be important to communicate with them about maybe putting in an internal jugular central line, a subclavian central line, rather than a femoral. It's less likely for a Clabsi to form if it is in the upper parts. And then another thing is CHG baths every day. CHG baths we can use are just a pack to wipe down the patient to allow the prevention of any bacteria or anything to form within that site. So my intervention relating to my Pico question is whenever you have a nurse bedside shift report, whenever you're doing bedside shift report, it would be important in the report study to possibly ask between the nurses, hey, do you know when the last central line dressing was changed? Hey, do you think this patient is still in use for the central line? And that could be something that where two nurses are having observation on it. And then if either nurse doesn't know what date this central line dressing would be changed, it could be documented in the EMR just so we could go through and see and find dates that are listed of whenever that dressing has been changed. Intervention effectiveness. Whenever prevention interventions are utilized, it can help decrease the risk of Clabsi's by 70%. And this will overall, as we implement these preventions, we will see a decrease in Clabsi rates. These are all just simple things that, sometimes we don't have time to do, but it is very important for the safety and to prevent harm for our patients, because as nurses, that is our #1 priority. And this is what my overall saying is: remember always to shine the line before you prime the line. Therefore, always clean your lines. Make sure you're having clean caps on your lines. Just scrub those lines as good as we can. Therefore, we can prevent all of these things from occurring. We can see that this is typically what a central line looks like. They are very large access, and they have multiple different ways to do prevention against Clabsies, because our number one priority is to keep our patients from harm, and this is just something as nurses that we can do that may be minor to help alleviate those risks.